हेलो गाइस। आज हम रिकॉल करेंगे डर्मेटोलॉजी एम्स 2019 के क्वेश्चंस। क्वेश्चन नंबर 1, पैच टेस्ट रीडिंग आफ्टर हाउ मेनी डेज? ए 48 आवर्स एंड 72 आवर्स, बी 48 आवर्स एंड 96 आवर्स, सी 72 आवर्स एंड 96 आवर्स, डी 24 आवर्स एंड 72 आवर्स। इसका करेक्ट आंसर है बी, 48 आवर्स एंड 96 आवर्स। 48 hours and 96 hours, any individual suspected of having allergic contact dermatitis or atopic dermatitis need patch testing. Reading of the patch test is taken after 48 hours and 96 hours, best reading, and then on day 7 for late reactions due to metals, PPD, etc. Question number 2. Topical steroids are most effective in A. Dermal atrophy, B. Eczematous dermatitis, C. Bullous lesion due to HSV, D. Rosacea. इसका आंसर है बी, eczematous dermatitis. Eczematous dermatitis or atopic dermatitis is a chronic disorder characterized by xerosis, pruritus, scaly erythematous patches, and thickening of the skin with enhancement of normal skin markings or lichenification. Steroids are the drugs of choice for eczematous dermatitis. Chancre redux is a clinical feature of A. chancroid, B. recurrent herpes simplex virus, C. early relapsing syphilis, D. late syphilis. इसका आंसर है C. early relapsing syphilis. Early relapsing syphilis. Chancre redux is a clinical feature of early relapsing syphilis, which is a rare form of syphilis that occurs during the secondary stage. During the primary stage of syphilis, a painless ulcer called a chancre appears at the site of infection, which can be genitals, mouth, or rectum. During the secondary stage of syphilis, the infection spread throughout the body and causes a variety of symptoms including skin rash, fever, swollen lymph node, and sore throat. Early relapsing syphilis is a form of secondary syphilis that occurs when symptoms from the primary stage reappear, including a chancre. Question number 4. Young HIV patient present with recurrent lesion over genitals, history of contact with a commercial sex worker. Which is the microscopic finding shown in the given below image? A. Intracytoplasmic inclusion body, B. Intranuclear inclusion body, C. Back with bipolar staining, D. Multinucleated giant cells. इसका आंसर है B. Intranuclear inclusion bodies. Intranuclear inclusion body, the given history of the patient suggests the presence of herpes. Genital herpes is a common sexual transmitted disease that is caused by the herpes simplex virus type 2. Then type 1. Most genital herpes infections are caused by HSV2. Herpes virus are associated with the intranuclear inclusion bodies, cowdry bodies, eosinophilic ground grass areas in the nucleus with margination of nuclear chromatin. Question number 5. Which cell is not present in the shown layer? A. Keratinocyte, B. Merkel cell, C. melanocyte, D. Langerhans cells. इसका आंसर है D. Langerhans cells. Langerhans cells, the arrow is pointing towards stratum basale, and the Langerhans cells are most prominent in stratum spinosum and papillary dermis. Question number 6. Arrange the following blisters in the order of from superficial to deep. Pemphigus vulgaris, epidermolysis bullosa, dystrophicaris linear, IgA bullous pemphigoid. Select the correct answer using the code below. इसका आंसर है B. 1, 4, 2 and 3. Pemphigus vulgaris, bullous pemphigoid, linear IgA and epidermolysis bullosa dystrophic. Question number 7. A patient from Uttarakhand presented in September with fever and myalgia. Patient started on IV ceftriaxone given but it didn't help. Later noticed cutaneous lesion on examination, black eschar in the axilla given below in the figure. What is your diagnosis? A. Scrub typhus, B. Anthrax, C. Kiasanur disease, D. Dematiaceous fungi. इसका आंसर है A. Scrub typhus. Scrub typhus, the given clinical history of fever, headache and body ache with a black star on the body surrounded by erythema is suggestive of scrub typhus. Question number 8. An 18-month child present with fever and neck rigidity and the sign and symptoms are given below the image. Which of the following is the organism is the causative agent? A. HSV type 1, B. variant of picornavirus, C. Varicella zoster virus, D. Mycoplasma. इसका आंसर है A. HSV type 1. HSV type 1, the given clinical picture is showing macules, papules, vesicles that tend target lesion which is suggestive of erythema multiforme. The most common cause for the same is infection with herpes. Herpetic gingivo-stomatitis causes HSV1 features: vesicles that rupture to form erosion covered by membrane associated with high-grade fever and constitutional symptoms. More common in children can be sexually transmitted or direct contact (HPE) of a mucosal herpetic infection, degeneration of stratified squamous epithelial cells, acantholysis, formation of an inflammatory infiltrate around capillaries of dermis, cowdry a body's complication, dehydration, herpes labialis, HSV encephalitis, herpetic whitlow, herpetic keratitis, eczema herpeticum, treatment acyclovir. Question number 9. A patient presented with joint pain and mild fever, NSAIDs prescribed by the doctor, developed pigmentation after 1 week on the tip of the nose. What may be the condition? A. Melasma, B. Dengue, C. Chikungunya, D. Fixed drug eruption. इसका आंसर है सी, चिकनगुनिया. Chikungunya, the given clinical scenario with centrofacial pigmentation involving the nose with history of fever, joint and back pain is suggestive of the chikungunya chick sign. Question number 10. ABCDE is used for which skin malignancy? A. Malignant melanoma, B. Basal cell carcinoma, C. Squamous cell carcinoma, D. Lichen planus. इसका आंसर है A. Malignant melanoma. Malignant melanoma (ABCDE) is used for detecting malignant melanoma, common tumors with a significant risk of metastasis, spread of melanoma, lymphatics and bloodstream. The metastasis can remain asymptomatic for months to years. Recurrence is generally diagnosed when a suspicious lesion is identified and biopsy reveals malignant melanocytes, tumor markers S100 and HMB45. Question number 11. A patient was treated with steroids for psoriasis. On stopping the treatment, he develops a fever, malaise, and lesions as seen in the image below. What is most probable diagnosis? A. Staphylococcal, B. Pustular psoriasis, B. C. Subcorneal pustulosis, D. Acute generalized exanthematous pustulosis. इसका आंसर है B. Pustular psoriasis. Pustular psoriasis, the given clinical scenario shows a severe widespread inflammation of the skin and small white or yellow pus-filled blisters or pustules is suggestive of pustular psoriasis, which often result upon withdrawal of steroids. Pustular psoriasis occur on sudden withdrawal of systemic steroids. There are sterile pustules at the subcorneal level. Generalized pustule fused to form lake of pus or sheet of pus. The pus consists of white blood cells and is not a sign of infection. On light skin, the affected areas will appear red. Triggers: a variety of factors, sudden withdrawal of systemic corticosteroids, exposure to certain medications, infections and treatment, topical emollients and steroids and systemic therapies. Question number 12. All of the following have infections present with maculopapular rash except A. Dengue during febrile phase, B. Rubella, C. Shingles zoster, D. Measles. इसका आंसर है C. Shingles zoster. Shingles zoster present with a painful rash with blister. It most often appears as a single strip of blisters that wrap around either the left or the right side of the torso. Question number 13. Which of the following is a true association? A. Lichen planus and malignant melanoma, B. Melasma and malignant melanoma, C. Psoriasis and metabolic syndrome, D. Vitiligo and metabolic syndrome. Select the correct answer from the given below code. A, B, C and D. The correct answer is A, C greater than D. Chronic plaque psoriasis is an immune-mediated inflammatory skin disease that is strongly associated with clinical features of metabolic syndrome. Question number 14. A patient present with flaccid bullous lesion involving the oral cavity and the skin over the scalp, face, trunk and extremities. He has a lesion as shown in the below image. Acantholytic cells are seen on the zinc smear. What is the most probable diagnosis? A. Pemphigus vulgaris, B. Bullous pemphigoid, C. Pemphigus foliaceus, D. Dermatitis herpetiformis. इसका आंसर है Pemphigus vulgaris. Pemphigus vulgaris, the given clinical